It is now time to hear from a distinguished leader whose vision and commitment to development continue to contribute significantly to the progress of Telangana. It is my honor and privilege to welcome our chief guest, Shri Vikramarka Mallu garu, Honorable Deputy CM, Government of Telangana, a respected statesman and public servant. Shri Vikramarka Mallu garu has been at the forefront for driving initiatives that strengthen infrastructure, foster inclusive growth, and enhance the quality of life for citizens across the state. His leadership reflects a strong commitment to build a future-ready Telangana where innovation, accessibility, and sustainable development remain key priorities. Ladies and gentlemen, with a huge round of applause, I would request Bhatti Vikramarka garu, దయచేసి stage పైకి రావాల్సిందిగా కోరుతున్నానండి. I want everyone, please put your hands together for the Honorable Deputy CM as he joins me here onto this stage.
Representatives of Times Network, fine. Respected, distinguished doctors and hospital leaders, heads of medical colleges, universities, nursing institutions, innovators from biotechnology, medical devices, telemedicine, and digital health, researchers, public health experts, industry leaders, friends from the media, and all participants gathered here from this morning. It is a privilege to join you at the India Health Summit 2026 South edition. A summit like this is not only a conference, it is a mirror. It shows us what we have achieved and what we have ignored, and what we must now build with urgency. Let me begin with a simple thought. Health is the most intimate form of governance. A delayed road creates inconvenience. A failed power supply creates anger. A delayed file creates frustration. But when healthcare fails, a family can be broken. A life can be permanently changed. A poor family can lose the savings of a generation. That is why health cannot be treated as one department among many. It is the first security of a citizen, the first infrastructure of development, and the first guarantee of dignity. Health is not only about hospitals, it is about safe childbirth, child nutrition, vaccination, early diagnosis, affordable medicines, timely referral, and whether a poor patient can enter a hospital without fear of the bill. Southern India has shown that public health is not a matter of luck. It is a result of literacy, women's education, nutrition, primary care, medical education, science, institution, administrative seriousness. The South has strong public hospitals and world-class private hospitals. Also, medical colleges and nursing talent, pharma, biotechnology, diagnostics, health tech startups, and research institutions. But leadership is not a certificate, leadership is a duty. If the South has better capacity, then the South must show India how healthcare can become more affordable, more preventive, more ethical, more data-driven, and more human. For us, in the Congress tradition, this is not a new idea. The Congress view of health has always been that science must serve the common citizen, technology must serve the poor, and institutions must serve justice. Pandit Jawaharlal Nehru ji gave India the courage to build scientific institutions when the country was still poor. In that spirit came institutions like All India Institute of Medical Sciences and a national belief that medical excellence must be part of development. The message was clear: a poor country must not have poor ambitions. Indira Gandhi's era deepened the understanding that health begins before the hospital. Nutrition, child development, and maternal care entered the mainstream of public action. ICDS, launched in 1975, rested on a profound truth. If a child is malnourished in the first years of life, no later policy can fully repay that injustice. Shri Rajiv Gandhiji brought the confidence that technology could travel to ordinary people. The universal immunization program gathered momentum in the time. That was not just a vaccine program, it was science traveling to the villages, to the Bhatti, to the last chain. Under Dr. Manmohan Singh ji and the UPA government, the National Rural Health Mission took this forward. The Asha worker became one of the most important bridges between government and the family. This is the legacy we inherit: institutions from Nehru, child development from Indira Gandhi, technology and immunization from Rajiv Gandhi, and community-based health from the UPA government. We do not invoke this legacy for nostalgia. We invoke it as responsibility. Telangana is carrying that responsibility forward in our own context. Our approach is clear. Good healthcare should not depend on whether a citizen lives in Hyderabad, has a high income, or knows the right person. The test of a healthcare system is how to treat the poor patient who walks in silently with fear in his heart and a file of reports in his hand. That is why we have strengthened Rajiv Arogyasri. The coverage has been enhanced from rupees 5 lakh to 10 lakh. Package rates have been improved. Additional treatments have been brought under coverage. This is not a technical adjustment. It is a message to poor families. Illness should not push you into debt. Treatment should not force you to sell land, jewelry, or dignity. But a health card alone is not health care. The card must be backed by functioning hospitals, available doctors, reliable diagnostics, affordable medicines, and a government that monitors outcomes. Hyderabad is already known as a healthcare destination. People come here for tertiary care, especially treatment, diagnostics, pharma, and life sciences. But our ambition must be larger than being a medical destination for those who can travel and pay. Telangana must become a public health capital, a state where district hospitals improve, medical education expands, nursing and allied health are respected, technology reaches the last mile, and preventive care becomes part of everyday governance. The future of health care will not be decided only inside ICUs. It will be decided in primary health centers, in schools, in Anganwadi centers, in the diet of a child, in the blood pressure reading of a worker, in early cancer detection, and in a regular follow-up of diabetics. For too long, healthcare systems everywhere have rewarded late treatment more than early prevention. We wait for blood sugar to become diabetics, hypertension to become stroke, pain to become cancer diagnosis, and families to reach crisis before the system fully wakes up. This must change. The next leap in Indian healthcare will be preventive healthcare. Screening, nutrition, mental health, sanitation, lifestyle change, early diagnosis, digital monitoring, and regular primary care. The cheapest ICU is prevention. The best surgery is the disease that never reaches the operating tables. The most affordable medicine is early action. This summit will discuss artificial intelligence, digital health, telemedicine, wearable technologies, and data-driven care. These tools can transform diagnosis, reduce specialist gaps, improve track, support doctors, and bring expert service closer to remote communities. But technology in healthcare must be judged by one question: does it reduce distance between the patient and care? If artificial intelligence remains a toy for big hospitals, it will not transform India. If it helps a PhD doctor detect risk earlier, if telemedicine saves a remote patient from unnecessary travel, if data helps government identify disease patterns before they become epidemics, then technology becomes justice. We must also remember that health data is not ordinary data. It carries fear, vulnerability, family history, and personal dignity, privacy, consent, clinical accountability, and transparency are not obstacles to innovation. They are the conditions for public trust. The great challenge before India is not whether we can build excellent hospitals. We can. The challenge is whether excellence can be made affordable at scale. A country of India's size needs world-class systems. Ambulance response, diagnostics, blood banks, infection control medicine, supply referral protocols, electronic records, nursing training, biomedical maintenance, hospital sanitation, and patient grievance redressal. Public-private partnership must not mean public risk and private profit. It must mean public purpose combined with private excellence. Healthcare is not delivered by buildings. It is delivered by people, doctors, nurses, lab technicians, pharmacists, sanitation workers, ambulance drivers, ASHA workers, counselors, public health managers, hospital administrators, and biomedical engineers. If South India wants to lead the next decade of healthcare, it must also lead the next decade of healthcare skilling. Telangana is ready to work with institutions, hospitals, and industry to build this pipeline. Telangana offers a rare combination, a growing economy, Hyderabad's medical and life sciences ecosystem, a strong pharmaceutical base, technology talent, research institutions, and a government willing to partner. The next generation of healthcare enterprises from Hyderabad should not merely treat disease, they should create protocols, devices, platforms, diagnostics, training models, and public health solutions that can serve India and the world. To hospital leaders, my request, I say expand, but also serve. To health tech innovators, I say build for India. For Indian languages, Indian incomes, Indian disease burdens, and Indian public systems. To investors, I say Telangana welcomes you, but we welcome investments that combine profit with purpose. The India Health Summit should not end as a collection of good speeches. It should leave behind sharper questions and stronger partnerships. How do we use AI without losing ethics? How do we expand insurance without weakening public hospitals? How do we prevent lifestyle diseases before they overwhelm families? How do we make district hospitals more reliable? How do we create enough trained healthcare workers? How do we build trust between government, doctors, hospitals, innovators, and citizens? These are not academic questions. They are governance questions. They are economic questions. Above all, they are moral questions. Let us move from sick care to health care, from treatment after crisis to prevention before crisis, from hospitals alone to homes and communities, from technology as spectacle to technology as service, from privileged access, from access to dignity. My dear friends and industry and innovators, I say build for scale, but do not forget the last mile. India's greatest health market is not only in premium rooms and urban hospitals. It is in affordable diagnostics, low-cost devices, and telemedicine, efficient supply chains, trained paramedics, and preventive platforms that can reach ordinary families before disease becomes disaster. And to government, including ourselves, the duty is clear. Create policy stability, invest in public systems, protect the poor from catastrophic expenditure, and hold every institution, public or private, to the standard of dignity. I thank Times Network for convening this important platform. I thank every doctor, nurse, researcher, entrepreneur, and public health worker present here. Let us work together so that healthcare becomes not a fear in the mind of the poor, but a guarantee in the hands of every citizen. Jai Hind and Jai Telangana. Thank you very much. And I also appreciate all the presented dignitaries taking all your valuable time, taking the part in these deliberations. Thank you. Thank you. Thank you once again.
Thank you so much, sir.
As you all aware, Telangana is rising in such a way that the state is dreaming to compete with the most developed countries in the world, not just the states in the country. With that ambition only, we conducted very recently global summit where we kept the target of taking the state to the heights of $3 trillion economy by 2047. Hope you all will join in that journey. Thank you.
Thank you so much, sir. I want everyone, please put your hands together once again. A huge round of applause. So, దయచేసి స్టేజ్ పైనే ఉండాల్సిందిగా కోరుతున్నాను.